Welcome to India TV. You're watching HealthDNA. I'm Anshu Jaising, and today we have with us Dr. Anu Dabar. She's senior rheumatologist, Paris Health. Welcome, ma'am.
Thank you.
Ma'am, what is osteoporosis and what are the signs and symptoms?
See, osteoporosis is a condition wherein there is reduction in the bone density. By bone density, we mean the strength of a bone which is naturally there. So see, as we grow, as we are born and as we grow older, the bones start to become stronger. Generally, till our late 30s, our bone mass or bone strength is at its peak. It's after the age of 30 because of hormonal factors, lack of exercise and activity, and when all these factors club together, the bone density starts to serially decline. Usually after the age of 50, 55, especially when women undergo menopause, there is a drastic decline in bone density. And this condition, when there are such specific cutoffs defined which have been defined how you describe osteoporosis, when they are met, we call this condition as osteoporosis. Unfortunately, the problem is that osteoporosis could be a silent deadly disease. You might not be having any symptoms, but you would significantly be getting your bone mass might be getting lower. So there are some features. For example, if a lady sustains a fracture when she's just slipped in the bathroom, but she sustains a fracture of the hip, requires hospitalization, or there is a female in the late 50s, she suddenly has a loss of height, and this happens more common in men. This loss of height. Men might suddenly have a loss of a height. They say that we've lost 1.5 inches of height, and that is because they would have sustained some fractures in the vertebra or the spine which were silent, or they're just causing some vague non-specific back pain. So these are some of the features wherein patients can identify, or they know that they should definitely get tested for osteoporosis.
Ma'am, how it affects the bone health, like if I see the long-term thing?
Yeah, so see, if your bone, there are three stages. A normal bone density, then there's something called as osteopenia. So this is the window of opportunity where the body will not probably give you any signals. All you'll be having some vague aches and specific pains, and especially this will happen either after the age of 55 in females, or if in a young female she has some risk factors. Now what could these risk factors be? If there's chronic smoking, if there is underlying inflammatory arthritis like rheumatoid arthritis, one of the very common causes for secondary osteoporosis, or if the patient is on some treatments, glucocorticoids. You see, in post-COVID, all of us heard steroids. So many patients had been given steroids, some where it was indicated and some where it wasn't. So long-term use of steroids, whether using it for bronchial asthma or you're using it for any skin condition, psoriasis, anything, can also lead to osteoporosis. Additionally, some patients who are on medications for fits or seizures, anti-epileptic medications, blood thinners, all of these are some reasons which eventually contribute to osteoporosis. And most importantly, lack of exercise. If your muscle mass is less, especially in men, your testosterone levels, androgen levels will start to decline, and they will then indirectly lead to decrease in the strength of bone. So these are all the reasons or the risk factors wherein we should definitely think, if you're having some unexplainable symptom or pain, do get yourself tested.
So ma'am, how common is osteoporosis?
Yes, so see, how do you measure osteoporosis is generally by doing a test called bone densitometry. So if I talk about the facts and figures, every female post 55, every second or third female will be having osteopenia or osteoporosis. And if you talk about fractures, 1 in 5 females post the age of 50, 55, especially when their menopause sets in. And now, unfortunately, in the Indian scenario, it's setting in much earlier. Women in their early 40s, late 30s are getting menopause. So there, the incidence is around 1 in 5 females would have had fractures. So it's becoming this common. Now, because of all these additional factors which I described, probably 20, 30 years down the line, there was a lot of physical activity involved, exertion involved. Now our lives are becoming much more sedentary. We are gaining weight. Weight is again a risk factor for this because obesity produces inflammation. Inflammation leads to decreased bone strength. So all of these factors, definitely age is the #1 reason why this happens, but now age is not the only reason. There are so many other reasons which have come in. That's why women are getting osteoporosis in their late 30s, late 40s as well. Not as common as those in their 50s, but definitely we are seeing that as well.
Ma'am, what are the tests available? How can we diagnose it?
Yeah, so generally one of the earliest clues that we get is on a plain and simple x-ray. So if a patient comes to me, they've had some fracture or some pain, normally so many times we order an x-ray. On the x-ray, if we see that the bones look unusually, we use a word called osteopenia. If they look unusually washed out, they're extremely white, then this means that definitely the patient's bone strength is falling. And that is the time we definitely order the next level investigation, which is called bone densitometry. So what this densitometry is, it basically measures the strength of your bone. So you put in through a scanner, which takes around 8 to 10 seconds. And in that particular time, it measures the strength of your bone at 3 places, 3 common sites. One is the spine, one is the hip, the femur bone, and the third is the distal arm, because these are the 3 most common sites where fracture happen in osteoporosis: spine fracture, hip fracture and distal arm fracture. So at all these 3 sites, the bone density is measured, and there are specific cutoff scores given, which are called T scores and Z scores. Anything a T score of less than 2.5, minus 2.5 definitely means that you have osteoporosis, and you should go to your rheumatologist or your physician at the earliest so that it is preventive. Now, I don't want my patient should have a fracture and then they should come to me and then I start treatment for osteoporosis. I would want that we are able to identify patients in the osteopenic phase or the osteoporosis phase without the fracture happened yet, where we can prevent those fractures. Because as these patients grow older, they'll be having some of the other conditions, frailty will set in, so the risk of falls increases. And in that situation, because of the bones being extremely thin, if they sustain a fracture, it becomes very difficult because a lot of other complications will set in. Surgery might be required, it will have its own complications. So prevention is the key here.
Ma'am, are there any guidelines, like when we go about testing, usually it is found that we have, vitamin D deficiency if we are, below 75. So are there any Indian guidelines?
See, so if you talk about vitamin D levels, whatever laboratory parameters that when you send your vitamin D, you will see some 0 to 30, 30 to 40, and a lot of patients will be focusing on those values. Those values are set for the European standard. That is, people who are taller built, who are skeletally, their framework is much bigger than what average Indian framework is. So there are no Indian cutoffs for vitamin D levels, but generally any level above 30 is good, is satisfactory. You don't need to keep pumping yourself with vitamin D supplements if you're somewhere between 30 and 40.
Ma'am, how can we prevent ourselves from calcium deficiency or vitamin D deficiency?
So the most important thing here is understanding how important focusing on each of these is. Now, I have patients who will be taking vitamin D weekly for a year, but their calcium intake will be very less. The work of vitamin D as a hormone is to allow absorption of calcium. If you are not having enough calcium in your diet, that vitamin D is doing nothing for you. It's on the contrary, just building up unusually toxic levels in your body. So it's important to understand how much of calcium do you need. So once a woman needs, generally in between the age group of 20 to 45, around 1000 to 1200 milligram of calcium is needed in a day. And that means 3 glasses of milk every day. Now tell me how many females in India will be fulfilling that norms? I don't think more than 30%. The problem comes here. So if we can make sure that if you cannot have 3 glasses of milk, there are alternatives. You can take paneer, there is curd, there is ragi, there is a lot of other food items where there is rich sources of calcium. And due to whatever reason, if you're not having enough calcium in your diet, there's absolutely no harm in taking a simple calcium supplement once a day, because eventually the target is to prevent osteoporosis, and that prevention starts when you're in your early 30s. So you have to plan for 20 years if you want to prevent osteoporosis happening when you're in your 50s. So make sure that your diet is rich in calcium, and with that calcium have your vitamin D supplements. Vitamin D is called the sunshine vitamin. So the best source of vitamin D is sunlight. And what's important is that sitting in the sun when you're fully clothed after having applied sunscreen is not the right way how vitamin D gets absorbed. 30 to 40 minutes of sun exposure, where 50% of your body area is exposed at least 5 times a week, is needed for some amount of vitamin D generation. And generally this much exposure, if you're not having, there's no harm taking it. I would say if you can take it for 6 months, once a month, it generally takes care of the levels well, if your sun exposure is very low. But if you're sitting in the sun in the morning, like you go for a walk or run in the morning, then I think the vitamin D level should be good enough.
Just like you mentioned, diet, how important it is to exercise.
Yes, so see, there are 2 things here. Osteoporosis can be prevented by controlling your weight in check, for which exercise helps, and second, keeping muscle strength intact. So generally, as we're growing older, we lose muscle mass. Our metabolism becomes slower. We start piling on what is called fat, or visceral fat and abdominal fat. Different kinds of fat start piling up in the body. So generally it's encouraged for women in their 30s and their 40s, if not every day, 20 to 30 minutes, at least 3 times a day, they should do muscle strength training. You need not go to the gym and lift heavy dumbbells. You can start off with simple self body weight exercises like squats and then burpees and these kind of exercises where the muscle strength builds up. Because good muscle strength and along with that regular exercise will keep your weight in check and muscles strong, so your risk of osteoporosis really comes down.
Ma'am, what are the treatments available? Are there any therapies therapies for osteoporosis?
Yeah. So generally, osteoporosis, it is treated on how severe it is and based on whether you've had a previous fracture or not. So if a lady comes to me with a T-score of -2.5, -3, she's not yet had a fracture. First of all, I'll try to educate her on all these factors which she can modify in her lifestyle. I have to make sure she's not taking any such medicines which are worsening her osteoporosis. Is she having any coexistent condition like rheumatoid arthritis, inflammatory bowel disease, chronic liver disease, or asthma for which she's on high dose steroids? I have to first identify those conditions and make sure that they're well controlled so that we can remove any insults to the body which is causing osteoporosis. If despite all this, the levels continue to be low, she's at high risk of getting a fracture, we have different treatment options. There are injections which can be given once a year, which are not very expensive. There are injections which can be given 6 monthly, daily, tablets which can be given once monthly. How bad it is, like which level of osteoporosis it is, whether it's the spine that's weaker or the hip that's weaker, based on all these parameters, how is the patient's liver, kidney function? Because when we're talking about these therapies, we don't want anything going wrong. We don't want them getting an inadvertent side effect. So after having put all these things in mind, we then plan a treatment plan, and we have multitude of treatment options. Like there is no dearth. In today, as of 2023, in osteoporosis, we have more than 10 treatment options which we can offer to the patient.
So, are there any side effects of these supplements or medication that one takes?
Yeah, so generally any treatment for osteoporosis should be under the supervision of a rheumatologist or a physician or an orthopedician, because whenever we give these therapies, it's not that they're absolutely risk-free. There will be a small element of risk involved, and that is usually communicated to the patient well in advance that this is the problem, this could happen. If you have any such symptoms, rush to us, stop that treatment. And follow-up means regular 2-3 monthly follow-up, when we'll be doing the regular blood tests. Probably once in 2 years we'll be doing their densitometry to measure how effective our therapy has been. And generally the dictum in these therapies is after 4 to 5 years we give a drug-free period. So 2-3 years we'll stop everything, and generally the patient does well.
Ma'am, I just wanted to understand the difference between osteoporosis and arthritis. There's a lot of confusion between the two.
Yeah. So osteoporosis is a condition where the bone strength weakens. Arthritis, on the other hand, means arthron means joint and itis means swelling. It means joint swelling. Now, how are these two connected? Arthritis can be of 100 different types. There is a type of arthritis which is called osteoarthritis, where there is wear and tear and degeneration in the joints. Osteoarthritis and osteoporosis are conditions of the elderly. Both of these are usually seen in elderly males and females. There are some other types of arthritis. There's something called as rheumatoid arthritis, the most common type of inflammatory arthritis, where typically there'll be swelling in the fingers of the hands, there'll be deformities in the hands. Osteoporosis is very common in patients with rheumatoid arthritis if they have been given steroids long term, if their rheumatoid arthritis disease activity is not well controlled, and if they have had therapies which were not recommended or off-label therapies which have a lot of side effects. So if such risk factors are there, rheumatoid arthritis can lead to osteoporosis.
Is osteoporosis hereditary?
There are some types of osteoporosis, very rare although I would say, which are hereditary, wherein the risk of fractures comes in as early as teens. So somebody in their teens could have fractures. But again, these are very rare conditions seen probably in 1 in 10 lakh patients. That's not a very common scenario. And if you talk about purely hereditary, there is a small genetic component. Having some genes puts us at risk, but it's not that if my mother had osteoporosis, I definitely will, or if I have it, my children will. It doesn't work like that. Osteoporosis at least doesn't work like that.
So ma'am, on this osteoporosis day, what would be your message to people? How can we prevent it, and what would you like to say?
So I would like to convey to all those watching this, please do not be careless about your bone strength. So if you're as early as your late 20s and 30s, be conscious and aware, exercise well, have a rich healthy diet which has a lot of calcium, and do muscle strength training. If you have anybody around you who's had a fracture and it was a small slip and they had a major fracture, need not be very late in their 50s or 60s, tell that person that they should see a doctor for this. Osteoporosis is preventable. It's one of the few conditions where with proper treatment you can make sure the patient never sustains a fracture in their life.
Thank you so much, ma'am, for joining us. It was a pleasure talking to you.
Thank you.
Thank you.